Welcome to Cover Book Beat. I'm your host, Roger Nichols. Our guest today is a physician who is board certified in both pediatric pulmonology and general pediatrics, meaning he can deal with children and particularly those who have problems relating to their lungs. Ron Anbar is a leader also in clinical hypnosis, and his qualifications are stellar. He's 25 years of experience have allowed him to successfully treat over 7,000 children. He served as a professor of pediatrics and medicine and the director of pediatric pulmonology at SUNY Upstate Medical University in Syracuse, New York for 21 years. And he is a published author, more than 50 articles, abstracts, and book chapters on pediatric functional disorders and pediatric hypnotism. That experience has led him to his latest work, an impressive book titled Changing Children's Lives with Hypnosis. We're very pleased to welcome Dr. Ron Anbar.
Thank you so much for having me.
All right. Before we start in the book, I want to touch briefly on something. You mentioned this just kind of casually, but at age 16, when most teenagers are looking about getting their driver's license and trying to go dating, you volunteered at a children's hospital. Was that the beginning of your interest in medicine, or did it come before that?
No, my interest in medicine came later. I like children. I actually worked at a nursery school the year before, and I enjoyed working with children for many years, including at the children's hospital.
So what was there a specific thing that triggered your desire for medical school, or a series of events or coincidences?
Well, yes. When I volunteered at children's hospital, I met a young man named, who we called in the book Harry, who had cystic fibrosis, which is a very bad lung disease. And those days in the 70s, the life expectancy was only like 18, 19 years. Mm-hmm. And he became my friend. And for the next 7 years, we were friends. We were pen pals. And because of my interactions with him until he passed away, unfortunately, at the age of 19, I went into medicine.
And that's fantastic. You dedicate the book to one particular individual. Can you tell us about him?
Well, that was Paul. Paul is the patient who introduced me to hypnosis. So I'd been practicing pulmonology for about 15 years when I met Paul, and he had very bad allergies to milk. And he told me lately, when I've been smelling cheeseburgers, I've been developing asthma attacks. Jeez. I thought that was rather strange. And I asked him to imagine eating a cheeseburger, and he developed an asthma attack in front of my eyes. And I said, wait a minute, your imagination can bring on an illness? And then I thought, maybe your imagination can take you out of an illness. And later I found out that was hypnosis.
At what point did you take formal training in that?
Well, so when I first learned about it, I didn't know there was any formal training. I actually wanted to send Paul to work with somebody who does hypnosis, and he could learn about hypnosis, then come back and teach me. Mm-hmm. But Paul didn't like that. He said, I already have enough doctors. I want to work with you. And I said, that's nice, but I don't know anything about this. Mm-hmm. He said, I don't care, teenager. So I went to my friend, the psychiatrist at Upstate, and asked if I could learn about hypnosis. I'd always have an interest in psychology, starting from my college years. And the psychiatrist friend said I could go ahead and start working with Paul. He said, all good clinicians use hypnosis, whether they realize it or not. And when you learn about hypnosis, you just become a better clinician. So after reading about it and practicing with Paul for half a year, I learned there are actually societies of hypnosis where you can go and get official training. And I took several workshops. The one society I took training from is the American Society of Clinical Hypnosis. I mentioned that society because if anybody's interested in finding out more about hypnosis, that's a good resource. Their website, by the way, is asch.net.
All right, excellent. Happy to share that. As you point out in the book, there are a lot of misconceptions about the hypnosis. It gets a bad rap in the literature, all the way from Svengali to Ka in the Jungle Book, as you point out. There's also something I realized, that for 77 years, there was a newspaper comic strip called Mandrake the Magician, in which he would gesture hypnotically and people would see things that weren't there. So a lot of negative press over the decades.
Right. And in fact, cutting through the negative press is one of the main obstacles. And one of the reasons I'm hoping my book will play a major role in getting through to the public, so the public understands hypnosis is not mind control. Nobody's going to tell you what to do. Hypnosis is not sleep. Hypnosis even isn't unusual. We all do hypnosis all the time. If you watch a young child at play doing pretend play, that's hypnosis. If you ever listen to a boring podcast, not this one, and you start daydreaming, that's hypnosis. If you've ever driven down the highway 3 miles and said, how'd I get here? Mm-hmm. That's hypnosis. So hypnosis is a normal state of mind. And in that state of mind, you are more open to suggestions. And by teaching patients how to bring themselves into hypnosis, they can improve both mental and physical health.
You make a point too that you don't hypnotize anybody. You just teach them to hypnotize themselves.
Correct. All hypnosis is self-hypnosis. So when people ask, is it safe? Yeah, it's safe as long as you're safe with yourself.
Yeah. Well, hopefully most of us are at this time. You get in situations. The thing that just floored me was just a little line in the book where you said that you had a patient who was eager to learn, and his parents said they were university instructors and didn't believe in that. And my thought is, what's the scientific method? You would dismiss something without looking at the evidence? I find that ridiculous, but you probably encounter that from time to time.
We encounter that from time to time with parents, fortunately not commonly. And, you wonder, that particular young man had seen 5 other medical centers for his condition. Nobody could figure out what was wrong with him. And I recognized his symptoms as being stress driven, most likely. And I offered to help him, but the parents, for whatever reason, you can speculate why they don't want to do it. Mm-hmm. However, a bigger problem is the physicians and healthcare providers who won't look at hypnosis as a viable alternative. Every patient with chronic symptoms can potentially be helped by hypnosis. Let me explain why that is. If you have chronic symptoms, for whatever condition you have, it's going to affect your psychology. You might be anxious about it. You might be depressed about it. And if so, learning how to regulate your emotions will help. And then there's a significant number of patients who develop physical symptoms because of their psychological situation. A child who's bullied in school might develop stomach aches. If you have a stressful day at work, you might develop a headache. So it's common events. Those patients benefit from hypnosis because they learn to regulate their emotions again. So every patient can benefit. I will tell you, if you are a patient whose symptoms are not being controlled well with Western medicine, think about psychology early on in your care. Don't wait until everything else doesn't work before trying psychology. And hypnosis is a great tool to help deal with your own issues.
The number of conditions that can be exacerbated by anxiety is amazing. And you list some of them in your book. You think about bedwetting. You think about headaches, stomach aches, asthma attacks brought on by anxiety, and that sort of thing. It's a huge ability to help. And you list a number of cases where do you have a case you want to tell us about today?
Sure, there are many cases. I guess one of the more dramatic cases was a 6-year-old young man who had seizures. And the seizures happened because he had a brain bleed shortly after he was born, and it damaged part of his brain. And the seizure would start in the right side of his brain, and then he'd tell his mother something is going on, and then they'd spread to his left side of his brain, and then he'd have a total body seizure. And I'd wondered for a while if you could prevent seizures with hypnosis. And my reasoning was as such. You can train dogs to alert their owners before they have a seizure. So there's some signals before you have a seizure. Suppose you could think differently, and since seizures involve the brain and brain waves, if you thought differently, maybe you could head off a seizure. That was my thought. So I asked the mother, can I teach him hypnosis? She said yes. Now, at 6 years old, hypnosis is very different than it would be with an adult. So with this young man, I asked him who his favorite character was, and it was SpongeBob SquarePants. Personally, I hate SpongeBob SquarePants, but he's helped a lot of my patients. So I said, what is SpongeBob made out of? A sponge. I said, okay, and what makes him a sponge? He has holes in him. I said, that's right. So every night, put SpongeBob on your head, and if a storm comes at night, let the storm go through the holes in the sponge and not stay around. That was intervention, 1 minute long. Every night he would put on his SpongeBob. Initially put on his SpongeBob toy, but later he just imagined SpongeBob on his head, but he'd wrap it around his head sometimes several times just to make it exactly right. And he hasn't had a seizure since. It's been 8 years. He was having seizures 3 times a month. They stopped cold. Yeah. His EEG, his brain waves, still were abnormal, but he didn't have any more seizures. So now there's a disconnect between the physiology and his symptoms.
Yeah. Yeah, boy, I take notes when I read books like yours. I have page after page of them. We won't be able to go through all of them, but I want to point out something I mentioned to you before we started, and that is this is a book that can be used profitably both by parents and caregivers and also professionals, because you cite all of the studies that you perform very, very professionally in the book so that they can look up all of those. one of the key concepts in the book is the idea of functional symptoms, and we probably should define that for people.
So a functional symptom is a symptom that you cannot find a physical cause for it, but it serves some function. So if I can tell you a short example of that.
Yes, please.
There was a young man, 12-year-old young man. This story is not in the book, who had vocal cord dysfunction. That's where your vocal cords close when you're trying to breathe in. And that's on top of the airway. It's hard to breathe. And he'd had it for a year and he wasn't getting better. And when I met him, I taught him how to calm himself. And then he still had some problems, and I taught him how to talk to his subconscious, which is something I do a lot, tapping into the patient's inner self, so because they often know what's going on. And the subconscious explained that a year beforehand, this boy was so despondent, he almost committed suicide. He almost hung himself. And he was so distraught by this that he couldn't breathe. It was a recurrence of what he had gone through almost. Mm-hmm. So once we understood that, he started breathing okay. But the next week, he became blind. And when I talked to his subconscious, it explained he became blind so he wouldn't see the hangers to remind him of how he almost hung himself. So we talked through that. And the next week, he became deaf. And why? The subconscious explained because he didn't want to hear something that would trigger him. So we talked through that, and then he could hear and see again. But the next week, he couldn't use his arms.
Oh, my goodness.
Why? So he couldn't hang himself. So we talked through that. And finally, that was good enough. And he's been fine for the next couple since then, for the last 2 years. This is how complex physical symptoms are with psychology and how important it is to identify the issue and deal with it.
I think another thing we ought to stress is people talk about psychosomatic disorders. The effects on the body are absolutely real. This is not imagined. I mean, when they close out, actually closes off the airway when it happens. So it has to be treated very seriously. This is not imaginary.
Correct. It's not imaginary. And some people can have these symptoms for years and nobody can help them. Mm-hmm. We should also say it gets even more complicated if you have a physiological disease, such as asthma, for example. Mm-hmm. So asthma is spasm of the airways that get filled with mucus and need medication. However, anxiety can mimic asthma. So if you're very anxious, you can be out of breath. So a child with asthma becomes anxious because they can't breathe. That would be a normal kind of response. And then they can't breathe because they're anxious. And the doctor keeps trying to treat just the asthma, doesn't get full response because it's anxiety that's causing the shortness of breath. I've met kids who have been on oral steroids, which is really bad, for a long time. If oral steroids for a short course is fine, but like for years, they've been on oral steroids to control their asthma with a lot of side effects. And the problem was anxiety that nobody was addressing.
You mentioned, I want to circle back to the subconscious, which I found absolutely fascinating, how you were able to bring the subconscious out and communicate with it, first with simple raising a finger for yes or no, and then later speaking and then even using a keyboard. How fascinating was that when the first time you were able to do that?
When it first came, it was like amazing. Like I was wondering, talking to inner self, I had all sorts of existential questions. And I actually ran through them with my first patient, with Paul, and his subconscious knew a whole lot more than he did. It was fascinating to see how knowledgeable the subconscious is compared to the conscious self. And what I teach kids is how to tap into their own subconscious so that they can become enlightened. A really quick story. This has happened a month ago. This young man, terrible anxiety, terrible depression. Life has no meaning. He's 15 years old. I meet him. I teach him on the very first visit how to talk to his subconscious. I say, does subconscious have any advice for you? It says, yes. What's advice? He should not care about what other people think, and he should take a trip. I said, are those new ideas to you? He said, yes. I said, all right, well, listen to him. He said, how old is my subconscious? I said, I don't know, ask him. He says he's very old. Okay, he goes home. The next week he comes to see me and says, I've been activated. What do you mean? I'm happy, life is good, I'm interacting with my friends, I've gone to the gym for the first time in ages, my muscles are sore, but it feels good, colors seem brighter, life is good. Just by realizing what's inside him, he transitioned, he became activated, as he said.
Yeah, the perception.
Very powerful.
Yeah, as you point out, perception is everything. Bad things can happen, you can be stressed, but if you know how to react to it and how to treat that, perceive or reframe it, which is another thing that you mentioned a lot, it can be well. I found some interesting things. Talk a little bit about the placebo effect too.
So the placebo effect, people think a placebo effect means it doesn't do anything. That's wrong. Placebo effect means you improve based on the expectation that you'll improve, not because of the medication. So traditionally, in a study, they will give you a fake pill to see if you'll improve anyway. And if you do, then the response is not from the drug, but it's from the expectation. Western medicine acknowledges the placebo effect. That's why all studies, good studies, are double blinded. That means neither the patient nor the doctor knows whether the patient is taking the drug. The patient can't know if they're taking a drug, because if they do and they know it's a fake drug, it might not work so well. Mm-hmm. And the doctor also, if they know they're giving a fake drug, might not judge it to work as well. And also the doctor communicates in some way to the patient what they know. Yeah. So while Western medicine knows the placebo effect, they don't use it. So for example, when I used to be practicing pulmonologist, if a mother called me and said, my child has a cough, what over-the-counter cough medicine should I give him? I said, don't give him any, because studies have shown they're no better than placebo. But that was incomplete advice. Yeah. Because while they're no better than placebo, placebo does work for cough. So better advice would have been, give him a teaspoon of honey, give him a teaspoon of chicken soup. Yeah. The act of giving and receiving is healing.
It is. And sometimes you mentioned about authority figures reinforcing this is going to help you, also as a perception.
Right. And the connection, by the way, with hypnosis is, with hypnosis, the child also has an expectation of improvement. And so part of the power of hypnosis is expectation it will help. So it plays in the same ball field as does the placebo effect.
Absolutely. Wow. I find it fascinating the subconscious claims to be older than the patient itself. But in some of the stuff you've transcribed for it, it speaks as if it were much more developed, mature sort of recitation. That must be fascinating for you.
It is fascinating. I will say that the only subconscious I know, and I've talked to thousands, are the ones that have come to work with me. So it's possible what I've observed about the subconscious are the only ones who want to work with me, or only ones who are willing to do therapy.
Yes, we have to be careful about inferences here. Yes.
That's right. And it's also possible that the reason subconscious say they're older is because I tell the child ahead of time the subconscious is going to be wiser and smarter than you. But when I first started, I didn't have that bias. When my very first patient, I had no idea. So I developed that idea because that's what I saw, and I just reported back to the patients. With that caveat in mind, when I asked the child, well, how can your subconscious be older than you are? That always makes them think. Sometimes they'll say things like, maybe they develop faster. Other times they'll say, maybe they have a past life. And I guess I'll leave it up to listeners to figure out why they say that. I mentioned past lives. I don't do past life therapy routinely. However, if a patient will flash back to what seems to be past life, I don't shy away from it. I'll work with that past life as well.
I think one of the things that I was impressed with was the imagination you come up with to reach people on their different levels, because you're talking about people sometimes as young as 3 or 4 that you're able to help, plus all the way up into the sarcastic teenagerhood. You always are able to find an example that works for them. And one of the things that I think helps is you put a somatic clue as well, like crossing your fingers when you want to feel calm, or making an okay sign. That's more mind-body connection working for you.
Right. So I will tell the patient, whenever you want to relax, for example, cross your fingers, and that'll remind you to trigger the relaxation response. I also want to go back to what you said about always finding something to work on. I use what the patient brings me. So the 6-year-old brings me SpongeBob. A 16-year-old might bring me a beach or a surfing experience. So whatever they give you, I will morph into something therapeutic for them. And that makes it relevant to the individual child, which is part of why I'm successful helping them.
And yeah, if it comes from them, you have buy-in automatically on it, basically.
Right. There are some therapists who read protocols. Oh, you've got an anxiety. I'm going to read you an hypnosis script for anxiety. Well, that doesn't fit the patient. So it's not going to work as well.
What do you hope that people take away from the book when they close it?
I hope people understand that the mind-body connection is vast and strong and needs to be utilized for every person, period, especially people who are not doing well in life. And I'm hoping people will go to their healthcare provider and said, I want to learn hypnosis. And the healthcare provider would like to say, I don't know anything about it. And the person say, well, find out about it. Or as I mentioned before, potential patients can look up the American Society of Clinical Hypnosis to find somebody local who can help them. But medicine moves very, very slowly. 70 years ago, the British Medical Society and the American Medical Association recognized hypnosis as a viable tool for pain relief. But I never learned about it in medical school. People don't, things move so slowly, especially if there's no drug involved, so there's no money to be made. So I'm hoping the public will move it along.
Well, something that's non-invasive and actually works gotta be accepted down the road, because we are practical people. If it works, I'm all for it. So I'm hoping that attitude spreads more.
I can tell you, physicians who send me their patients do keep sending me more and more, even though they don't quite understand what happens here, but they know it works. So they are quite accepting of this once they know about it.
All right. Is there anything we've not talked on? There's so much we could talk on that we want to make sure gets mentioned for sure.
Well, if somebody wants more information, they can go to my website, dranbar.com. That's DR, A as in Apple, N as in Nancy, B as in boy, AR.com. And of course, I want to encourage you to get my book, Changing Children's Lives with Hypnosis. It's available everywhere books are sold.
Yeah, there you go. There you go. And it's an excellent book, and I highly recommend it. You have been most gracious with your time today. I know you're hard at work, but you took time out to help us out with this. And please keep up your excellent work, and let's hope we can spread the word.
I appreciate so much the opportunity to talk with you.
Yeah.